something in the medical career, but I did not think I didn't want to do direct patient care. So I was going through different colleges, different catalogs, and I found a degree for medical technology. It's all working in the laboratory using science and but still being able to be in a hospital or a clinical setting where you're helping patients, but not directly.
Good, good, good. And again, anything I say, I will edit out, so don't worry about that. Second question, Amanda, how hard were the science and medical laboratory courses you took in college?
They're pretty difficult at times. I would say they are doable for people that are passionate about science. I wouldn't say that I am 100% really good at chemistry, but I was able to make it through. And it's actually kind of funny that you asked that because in high school on my the ACT, my science was actually my lowest score. So when I told my parents I wanted to go into clinical laboratory science, they said, Amanda, are you sure? And I said, I think so. I really enjoy science. And I might have scored lowest on it, but it worked out for me. I've been in the clinical laboratory field for 5 years now, and I don't feel like that ever hindered me.
Nice response. Nice response.
Yeah.
Next question. Tell me about the laboratory intern. I'm going to ask it again. Tell me about the laboratory internship. Was it scary? Did you learn a lot?
Yeah, so I went to Mercy School of Clinical Laboratory Science. It was a challenging year, I will not lie. It was exactly 48 weeks, so just about a year of 5 days a week, 7:30 to 4. We would show up. We would do a lot of classroom time for the first 4 to 5 months, and then the last 5 or 6 months we were directly in the laboratory with people training us and showing us what we learned in the classroom, and then we were applying it there on the actual bench in the laboratory.
Cool. And I'm going to ask you to scoot back a little bit from the camera, cutting off the top of it. Okay, that's perfect. Good. You were getting into the conversation, man. You were leaning in there.
Push my computer back.
Of course. So, Amanda, what's the best part of working in a hospital laboratory?
I think the best part, sometimes we get a little, you'll probably have to edit this out. Um, the best part about working in the lab, I think, is seeing when you're actually helping the patient. Sometimes you'll get a hematology slide where you're looking at the inside of somebody's body, you're looking at their blood, and you can see all of these different things that's going on with them. You could see lots of white blood cells, meaning they have an infection. You could see that their red blood cells are too small or too big, or they're not the right size. And I just think it's so neat that you can see what's going on with them by just a drop of their blood. It's actually really amazing, and that just skims the surface of what we do in the laboratory, but it's very neat. And there's blood bank where you're giving people blood products, you're saving their life. And I know I said it's not direct patient care, but we are really helping the patients. 80% of what the doctors, how they treat a patient is based off of clinical testing.
And what's the worst part about working in a hospital laboratory?
That one's hard. I think sometimes it is not always just science. We have to work with all the departments in the hospital, and sometimes we have an idea of what we need to do. They have an idea of what they need to do, and sometimes it's difficult. Sometimes we don't get a good specimen for any number of reasons, and we have to tell them we can't run it, and or run the test, and they're upset about that, which is fair, because they have to go back and tell that patient we've got to get another urine specimen, we have to get another blood specimen, and that's not fun for them, and it's not fun for the patient, and it's not fun for us either. But that's just part of working in the laboratory. But there are also great parts, like I said before, so it's okay.
And but before I ask the next question, I remember I talked with Adria. She and I had a regularly scheduled phone call this week. I'm going to say nice things about you. Are you okay with that?
Yeah, that's fine. We got along really well. I really
Well,
liked
keep this between you and me, because I don't know that she would want me to share this confidence, but she shared that you truly exhibited the role of being a leader somewhere in BJC. Now, I'm paraphrasing what she said.
her. Oh, good.
She said that a couple of different ways. So you impressed her. So I just want to make sure that I shared that with you.
Oh, thanks, Gary. I'm glad. I told her how I really like to advocate for laboratory careers no matter where I'm at. And she was like, I'm going to write your name down and I'm going to, like we'll be in contact even, outside of this job interview. And I was like, that sounds great to me because I really am still trying to advocate, even within BJC, without BJC, we need to get more people in the lab because it's great.
And she's struggling. I'll be honest. I can tell from our first couple conversations, she can't find registered talent out there anywhere.
Mm-mm.
And
She
you're not
can't find
you're
it.
not going to be shocked. I know that. And I think she's scared. When she and I talk, she is so grateful that I can send her anybody, registered or non-registered, because they're just not out there. And a lot of the blind resumes she gets from folks with the Bachelor of Science in Biology or Chemistry, they don't know what the hell they're talking about. Because the
Yeah.
ones I give her, I've briefed, I prepared them, I tell them what to say, they're ready to go. So anyway, before I got too far, I wanted to make sure I shared that.
Oh,
Okay.
thank you, Gary. Yeah, I liked her. Haven't met her, but
And you answer these questions well. You really do. Okay, next question. Think back to your high school and college science courses. How do you use that science in your career as a medical laboratory scientist?
the courses that I took in high school that probably helped the most were anatomy, biology, chemistry, and really the course in college that put everything together before I started my clinical rotations was a physiology class. So that really took physics that I had taken, it took biology, chemistry, and it put it all together of how everything works in the body. And that's why I really like clinical laboratory sciences because I feel like biology and chemistry is almost like a story within the body of this happens within your body and it causes this to happen and it causes this to happen and this is why this test could be high and causes this other test to be low, and it's actually really neat. But physiology for me was one of them that really started to make everything started to make sense of why I took all the classes before that.
And I can remember my anatomy and physiology class back in college, and it was a key
Yeah.
course. It really was.
Oh
It
yeah.
really was.
Because I take, you take organic chemistry and it's kind of like, I don't know when I'm going to use this, but it really did all start to make sense then in physiology. I was like,
You know, the A&P guy's name was Doctor.
really?
In Illinois, 1970 something or other. Dr. Pat Doctor was his name.
Wow, I mean, you have to go get your doctorate then.
There's no way around it. Okay. All right. So Amanda, if you had to give one piece of advice to someone considering a career in the medical laboratory, what would that one piece of advice be?
Hmm. Um. Oh gosh, that's a hard one, Gary. I'm trying to think. One piece of advice. Would that be like a technical piece of advice, or
Envision a high
and
school
then this
student or a
might
college freshman they don't know what to do. They're just clueless. They don't know what a laboratory is. You were there many years ago. In
So
retrospect,
one piece of advice that I could give for anybody looking into clinical laboratory science is that it is an amazing job. I enjoy it and I love it. If you get in there and you don't want to do this for 30 plus years like some, it is a great stepping stone to anything else. I was told once that your clinical laboratory rotation that you do is actually like the first year of med school. So if you wanted to go to med school, you've already taken a whole clinical laboratory science rotation. You know all of that. You would be starting med school with a step up. I just was able to get my master's with BJC, and I'm not sure what I want to do with it, but I was able to do that with this job because of you can do different shifts. You can work night shift, you can work evening shift, you can work day shift, and they worked with us to be able to get, move around our days, get time off to do that. It was very financially viable. um, we were able to do that. I think if you want to do clinical laboratory science, it would be it's a great job, and then it's a great gateway for other careers as well, if that's not exactly what you want to do forever. So that's what I can say. Do it.
That's one of the FAQs I asked, what other career options do you have? And I gave a whole list of bench tech, clinical supervisor, specialist, lab manager, director, vendor rep, all that kind of stuff. So I
Oh
kind
yeah.
of focused on
It's
that too.
amazing how much like you can
Yeah.
branch out from this job. Um, Definitely.
I know you work at BJC Healthcare. How do they support your professional growth and development?
Okay, so BJC, like I just said, they offer different type of master's degrees. They offer people who are MLTs, so they have their 2-year associates. They just brought in this new degree. You can go to SIUE and get your MT. At BJC, they do pay a little bit more for having your MT. They have a bunch of online education sources that I actually just signed up for Excel, Outlook. They've got a resiliency training, and anybody can go on and sign up for these and do online courses. I actually just signed up for some Excel courses because I feel like I haven't been using it a lot, and I've lost some of my skills. So I just went and signed up for that. So I'll do that in my free time, maybe at work or here at home. So they really do advocate for continuing education as well as for your own personal development.
And how much tuition reimbursement do they provide?
I'm not sure like how much they provide. I know my master's has cost $2,200 for a master's of healthcare administration. And one thing that
Out of your pocket, out of your pocket.
yeah, out of my pocket. So
Ask,
that's
say that again, please. What?
$2,200 out of pocket. And what I thought was great, some people like this, some people didn't, is that they just took it out of my paycheck in 6 different installments. So they did the first 1,100 last spring in 6 installments, and then they'll do the next $1,100 this coming spring. And so that it was a little easier on me. So because it just kind of like they just took it out of my paycheck, it went away. I didn't have to sign a check for $1,100 off the bat, even though that some people preferred to do that as well. So yes.
Have you done any COVID testing? And if so, tell us about it.
Yes, we do COVID testing at Missouri Baptist. If you are in college or even in high school, we do COVID testing using the polymerase chain reaction, PCR. I think it's actually really cool to think about. It's not hard to set up at all. It's you just take the little nasopharyngeal swab liquid that they like shove all the way up to the back of your brain. It feels like it's not really your brain. And then we take that liquid, we put it into a cartridge, and we load it onto an instrument. But what that instrument is doing is it has different target DNA or RNA strips that it is using to match with any viral DNA that it finds in that swab or that liquid. And it will replicate that hundreds of millions and millions of thousands of times in order to be able to detect the virus is present or not present within that person.
And have you personally done those tests?
I have. Yeah, we have a couple different tests that we do. One's like a quick antigen test that takes 15 minutes. It's not as sensitive. So it'll only pick up if you have COVID about 80% of the time. And then the PCR one that I just talked about takes about 50 minutes to not to set up, to run. And they're not hard to set up at all. We do it under, and it's not safe. I've never not felt safe or exposed. We all have our lab coats on, we have our gloves on, we have our mask on, of course, and we do it under a ventilated hood. So everything's under the hood and it takes up all of the particles and it vents them out in a way. And then we clean it with special bleach and then alcohol. And then we have this new special liquid that we have to clean up before and after we set up each test as well. And we throw away our gloves.
So in the last 12 months, just estimate for us, how many COVID tests have you personally done?
Oh my gosh.
Is
Personally
it
done.
hundreds? Is it thousands?
Oh, I would believe. I mean, any shift that I work, I can set up anywhere between 5 to 10, And that's just me. There's other people also setting up probably 5 to 10. I would say, oh gosh, I couldn't even count a lot. A lot. It's finally going down. We're not setting up near as many, and there was a lot of change too because we had any time we were able to get our hands on any type of kit testing, we would immediately buy in bulk this kind of test or that kind of test, and we would for a while be doing just this from this manufacturer, and then it would, oh, we ran out of those, we were able to get our hands on these, so we would do this manufacturer. So we've done different kinds of testing. We finally have kind of leveled out and we're not doing that as much, but it's definitely interesting at the beginning because at first they were like, we're doing this test, and they're like, don't do that one anymore, we're doing this one.
And then the last question, and I'm
Okay.
watching the clock just a little bit. Describe for us a typical shift for you when you go into your hospital laboratory.
So typical shift, I work night shift and I love it. It's a very intimate shift. There's only 4 of us working, so we get to know each other really well. It's usually a little slower, and we do maintenance. So we'll come in and ask any of our fellow evening shifters, how are you doing? Do you need help with anything? And if they do, then we'll help them. If not, we'll start to restock supplies, gather supplies that we'll need for maintenance. So that can be like bleach or alcohol swabs, and we clean it all the while. We're multitasking all the time, so that's why I love this job. I'm always on my toes. I'm always working. I'm never bored. I don't like to sit around and be bored. Um, and we go and we clean our instruments. We're releasing patient results. We're calling critical results. And then in the morning, it's actually some of our busiest times is around 4 a.m. is when they start doing all the hospital draws for all of our inpatients. So we're focused a lot on just patient testing there in the mornings, starting at about 4 a.m. And that's calling criticals, releasing results that hold up in our system, and yeah, that's just basically making sure our instruments are running well, all of our quality control is acceptable.
I'm going to say this one more time. You are damn good at this. There are,
Carrie, I love you. I miss talking with you in the lab.
there are some of these responses that are just fabulous.
Thank
And
you.
I'm gonna be able to use all of it for sure. Excuse me. So I do not have COVID. I just talk too much,
No, that's okay. Even if you had COVID, I wouldn't judge you.
and nobody would get it. I can't get it because I don't see anybody. Because kind of I walk each day through our subdivision, but outside of going to the grocery store, we don't do squat around here.
Oh, really? Oh, I feel like I'm venturing out a little bit more, but we all got the vaccine. Did you get your vaccine? Did you get signed up?
Well, no, because Connie is old enough, and I'm not quite there yet, and we will, but we're just waiting for it to get under control, and
Yeah,
we'll do it sometime in the next couple of months. Not a big deal. Not a big
yeah.
deal. Well, I can't tell you how grateful I am. I'm going to go ahead and stop the recording here.
Okay, that's fine.